This clip deals with two specific examples of health promotion settings. The first is healthy cities. The second is health promoting schools. Both are international initiatives to promote health. Now, the World Health Organization Healthy Cities Project was initiated in 1988. And it was basically initiated to demonstrate that the Ottawa Charter for Health Promotion could work in a practical setting in the context of making cities healthier. It is based on this notion that a healthy city or shire is one that improves its environment and expands its resources so that people can achieve their highest potential. And so we've got this idea that people can reach their full potential in terms of health and also economics. A healthy city or shire is conscious of health as a municipal issue and also as a community resource. And the WHO has made this quite open so that any city that's committed to health of its citizens can belong to this initiative, the Healthy Cities Initiative. So it's inclusive rather than exclusive. It's important to note, you might remember that part of the definition of health promotion is that it's a process. Well, a healthy city is based, the concept of a healthy city is based more on the process rather than outcome. That's a philosophy. However, of course, one of the problems with this is that how then do you accumulate evidence that a city has become healthier, is becoming healthier, or is healthier? And this is a particular issue. Associated with the process is the development of a structure to enable the process to go forward. So the Healthy Cities approach is essentially firstly a political type of initiative, which is to put health on the agenda of the decision makers in cities, whoever they are. There's a range of stakeholders who are decision makers within the city, to empower communities to lobby and advocate for public health at the local level, so the smaller community level, and to provide a mechanism by which these international initiatives like WHO's Health for All can be implemented at a smaller level, community level. Now, the principles of Healthy Cities, the Healthy Cities initiative, is that health clearly, and when we talk about health, remember we talk about complete state of physical, mental, and social well-being, not just the absence of disease. So health should be an integral part of urban management and development. Also, it's the premise, it relies on the premise that health can be improved by modifying the physical, social, cultural, and economic environments. And in fact, these settings within cities, so homes, schools, villages, workplaces, profoundly influence health status, and intersectoral coordination and collaboration is integral to success at the local level. So these are key principles that health promoting cities or healthy cities relates to. An important aspect of Healthy Cities approach, the Healthy City approach, is good governance. So basically, we need to have political commitment to health. We need to have intersectoral planning which addresses health issues. We need to have partnerships which extend across the city. We need to engage, involve, and ensure participation by the city. And we need to monitor our progress so we can understand what works and what doesn't work and what areas need to be improved further. The types of partnerships that a Healthy Cities approach might involve are links between, say, the community, certainly between local government and state government departments, and also non-government agencies. Now they could be non-government organizations like charities, but they could also be business. And in fact, business is a key partner, because much of the progress and development that is initiated in cities is due to business. Community participation is integral. And so citizens need to be able to take ownership of the particular initiatives in mind, and this requires community participation. And we looked at community involvement, community engagement in a previous lecture, and we know that there are different levels of involvement, from an observer status right through to be owning the project. And clearly, active community participation is an integral part of successful the Healthy Cities initiative being a success. And when we look at community participation, there's clear evidence that there's a real enthusiasm and energy, and also lack of resistance and the lifting of barriers to progress, which are quite important processes. Looking at local government health plans, the local health plans, the development of local health plans are integral to the Healthy Cities process, and essentially it means that we know where we are in terms of health in a local community, we know where we want to go, and basically we know how to get there, and we need to outline the roadmap from getting here to here. And that's what this is about, the formulation and adoption of local public health and environmental health plan. The plan is basically a roadmap to get from where we are to where we want to be in terms of health outcomes. If we look at a city health plan, this is another aspect of development of healthy cities, is we need to have a local analysis of health priorities. So this basically looks at the data, health data, and also looks at current health policies within a city. And it, again, is this roadmap of looking at what the particular issues are at a particular point in time, to look at all the different agencies that impact on that particular health issue, and then a pathway forward as to how we might be able to improve the health within a particular city. If we're looking at municipal health planning, public health planning, there are a variety of frameworks. This is one framework that we might be able to use. So essentially it's a structured approach to developing a plan. Now up the top here we've got the evaluation and monitoring and review of the plan, and right down the bottom we've got the groundwork. And so there's this stepwise approach that is implemented to arrive at a fully developed plan. So, and a lot of this is about setting up structures, assessing community needs, so getting the community involved, in identifying what the priorities are, and then developing a roadmap or strategies. And then basically from that, the plan can actually, the draft plan can actually be written. A very important part of this, of course, is the implementation of the plan, the monitoring of the plan, and basically review to see if, in fact, the plan has had any sort of impact. So it's a fairly, this diagram is a fairly, is based on a fairly basic type of process, which is more about project development. Now we have an example here of Townsville. The city of Townsville in North Queensland implemented a Healthy City project, and that was the local city council. And basically the vision was very consistent with the Ottawa Charter for Health Promotion, and that is to recognise health as a valuable resource to the community. And without health, the community couldn't function. And so we look at the Health Advisory Committee. You can see it's an intersectoral committee comprising the local governments, the City Council, but also local health experts from one of the universities, nursing, medicine, state government public health unit, um, but also other sectors, so education sector, um, the Department of Communities, so state government, but from sectors outside the health department, plus community representatives. This is actually quite important. Now, you might ask, well, we've got 3 members from the community. How is that possibly representative of a population of hundreds of thousands? And that's always going to be a problem as to who represents the community. But suffice to say, it's important to have representatives anyway. So, in the process of looking at what the needs of the community in Townsville are, there were a range of issues that arose from public consultations, and there is also some strategies developed to actually pull this information together. So basically there's data that are recorded routinely anyway, looking at what health services inadequacies there are to identify what needs to be done, to engage the community in surveys, and also looking at focus groups to also zero in on what the general understanding and feeling and needs of the population are. And essentially these focus groups were set up to deal with specific issues. And the themes that emerged from this consultation were in the area of lifestyles, the physical environment, the functioning, the establishment of properly functioning communities, and also partnerships between government, community, and industry. Then we move beyond. This is what. So we had this area of healthy lifestyles. So these are very global, healthy lifestyles, environments, communities, partnerships. But then, as part of the planning process, the roadmap of getting from here to somewhere in the future and improving health, there are a range of specific initiatives that were addressed. So in the lifestyles area, we see things like substance abuse, physical activity, sun safety, nutrition, spreading of disease, whether it be sexually transmitted disease or mosquito-borne diseases, facilities for exercise, etc. The healthy environments, looked at various issues, for example, the use of open spaces, wild dog control, domestic dog control, basically sources of potential disease spreading, how to actually look after the health of the community, so looking at men's health, social isolation, homelessness, resilient families, special needs, people let back out into the community after a stay in a hospital, who cares for them, and also healthy partnerships, so identifying which organizations in the community had the capacity to interact in this sort of intersectoral environment.